health. With summer in full swing, it's important to remember the dangers of heat exhaustion and heat stroke. Our health reporter Haley Hernandez is here this morning with another warning for those taking certain medications, Haley.
Yeah, and this is a good one. So joining me this morning is Dr. Andrew Barr, and he's here to talk about how medications make you sensitive to the sun, sensitive to overheating, and could change the way that your medication actually works, right? Is this something that concerns you?
Absolutely, Haley. We know it's been incredibly hot this summer in Houston, and so really worried about the impact that heat has on especially our seniors that we take care of at Dedicated Senior Medical Center. Really focusing on a couple of different things for medications. So certain medications can cause photosensitivity of your skin in the sun, and then other medications can actually set you up for heat injury.
Do you know about are there any specific medications that you know that this happens with?
Sure, there's some very common medications. The list is actually quite extensive, but some very common medications for photosensitivity that could actually set you up for a sunburn. The most classic are certain antibiotics like tetracyclines. You may have heard of doxycycline, or fluoroquinolones like ciprofloxacin. Also statin medications that help control cholesterol can set you up for that, as well as some diabetic medications like sulfonylureas, which you may have heard of glipizide or glyburide, even over-the-counter medicines like NSAIDs for ibuprofen or naproxen, and some antihistamines, some skincare products, alpha hydroxy acid preparations, and cosmetics. So we have to be really careful with those as we take them.
It'll make you more susceptible to a sunburn?
It sure can.
Oh, wow. I didn't realize that over-the-counter medicines could do that too.
They can, absolutely.
We did have a viewer ask about blood pressure medication, hydrochlorothiazide.
Correct, yeah.
What do people with high blood pressure need to know about medications in this?
Yeah, so the first key thing is take your medications as your doctor has prescribed them for you.
And don't not take your
medications. Very important. Certainly if you have any questions, talk to your pharmacist when you're getting those medications, or talk to your physician. But certainly there are classes of medication that can set you up for the way your body processes your fluids, and especially diuretics, which take water out of the body. Things like thiazide diuretics like hydrochlorothiazide or Lasix, many people are on that. Even some regular blood pressure medicines like beta blockers or calcium channel blockers, ACE inhibitors, all of these work very, very well for controlling blood pressure, but can set your body up to be a little less resilient in the summer to dehydration.
Dehydration is the one that they have to worry about.
That's right.
What about the medications themselves? Will they become less effective if they're in the sun? Like say you get a mail-in prescription, if it's sitting in the mailbox for a little while before you check it, is that going to change the efficacy of the medication?
Yeah, that's a great question, right? So certainly most medications you can store at room temperature. The one we get very concerned about are things like insulin, which most of them need to be refrigerated, and so leaving those in your car or out in a hot environment is probably not great for the efficacy there. Most things getting mailed, if you have questions about that, certainly contact your mail order provider, but most of those are okay in transit, but just keep them in a comfortable environment.
Mentioning the insulin made me also think of epinephrine. Would that change if, because you want to have those emergency stashes in your car or something like that, would that change anything with that?
Yeah, again, extremes of temperature for most medications is not a great thing. Certainly the best thing to do is talk to your pharmacist about it when you get that at the pharmacy.
And we are living in extreme temperatures right now. It'll sneak up on you. So any tips before I let you go about just being safe in the sun right now?
Yeah, again, appropriately stay hydrated, get in cool places, take breaks, while you're working outside. A lot of our population, a lot of our great citizens here work outside and have jobs, and it's really important to pace yourself so that you don't get dehydrated. If you find symptoms of dizziness, fatigue, headache, those are symptoms to tell you to really kind of take a break there and recover.
Yeah, especially important for your patients at the Dedicated Senior Medical Center.
That's
Dr.
right.
Barr, thank you so much for coming in and talking to me.
Appreciate it.